My name's Vicky Levers and I'm the clinical lead for the young adult service here at Sherwood Forest Hospitals for diabetes. For the last year I've been working collaboratively on behalf of NHS England to improve the young adult services for the Trust. This has involved developing an innovative model of care to encourage better engagement for patients, reduced hospital admissions and better long-term outcomes for patients too. During that time we've managed to recruit a clinical psychologist and a young adult lead dietitian with a special interest in eating disorders, and these clinicians are present within all young adult clinics.
Hi, I'm Anna and I'm type 1 diabetic, and I've been diabetic for 22 years. I was 4 years old when I was diagnosed with diabetes, and it was quite hard at that age. I barely understood what was happening to me.
Hello, my name is Dr. Gemma Pashek and I'm the clinical psychologist for the Young Adult Diabetes Service. My role is to work as the clinical psychologist on a one-to-one basis with patients, but also to provide an holistic care model for the team more generally.
Diabetes is one of the most challenging things that I've had to face in my day-to-day life, from watching my friends eat what they want, having to leave the room and inject, hospital trips, things like pumps and taking injections.
So what we know is that psychological distress is paramount and part of the presentation of a young adult with diabetes. We know that young adults have higher rate of DKA than older adults and also children. We also know that they have more hospital admissions and that they struggle because of the time that this is happening in their life. Adolescence is a difficult time for young adults anyway. They may be leaving home, they may be going off to university, they may be living independently for the first time, they may be starting new relationships, breaking relationships. All of these normal things that happen during adolescence are amplified and become more problematic for somebody that is also living with a long-term condition like diabetes.
As a young girl, I had a lot of support from my parents regarding injecting and making sure I was doing what I needed to do. But as I grew into a teen, I found it really difficult to adjust. Again, with school, being different, my weight was a lot lower because of my fast metabolism and my body attacking itself a lot with not looking after it. I spent a lot of my teen years in hospital, and yeah, it was just really, really difficult.
Hi, I'm Michelle Holmes and my role is the young adult dietitian in the young adult diabetes service. My role really is to support the young adults coming through into our service with regards to their kind of dietary side, managing the diabetes. So this often tends to revolve more around kind of carbohydrate counting, education, but also supporting wider aspects of dietary management as well. And it doesn't always have to be specific to diabetes. There could be underlying other dietary related difficulties people are struggling with, and again, as dietitians we're trained to support you with managing those conditions as well. We're also very active involved in providing structured education as well. So you may or may not have already attended a carbohydrate counting course or a diabetes education course. So here in our young adult service we are delivering those courses as well.
We've also managed to roll out other clinics across sites, as Sherwood Forest Hospitals is a multi-site facility. And historically the young adult service was only based here at Kings Mill, and the patients living elsewhere would sit under general diabetes. So now we've managed to set these multidisciplinary teams over at Newark as well, and that also includes the young adult pump clinics as well that are newly set up.
Hello, my name's Lewis and I've got type 1 diabetes. The service helps me by offering many services such as rapid access options, easy access, regular contact via many formats such as email, text, even some online services. They do try to keep people out of hospital where they can, which is very good, so they try to treat you by contacting you directly rather than having you on site.
So the aim has been to destigmatise the referral process into other specialist services like clinical psychology and dietetics, and we have them as an active role within all of the clinics, and the uptake has been amazing really, in the sense that engagement has improved. We have our own model of care values as well to try and encourage holistic care. We've destigmatised that referral process into those services, and patients are seeing the additional members in the team as the norm now, and familiarity and engagement is much improved. Thank you for taking the time to watch this video. I hope it's opened people's eyes as to what the role of the service is and the vision for the future for patients aged 18 to 25 living with diabetes. If you've got any more questions, then please feel free to contact me.